but when I was doing my, training, psychiatry training, I soon noticed that the medical part of the psychiatry doesn't satisfy me. Like, we have a few drugs, they work to some extent. It's not very complicated, but we have complicated patients that we can do a whole lot with medications.
Yeah.
And so, soon I noticed I want something different.
Mm-hmm.
And I found psychoanalytic ideas and therapy deep enough to satisfy.
Yeah. From what you've said, I sense that you had a kind of maybe almost a kind of spiritual hunger for a deep engagement with life and with people. And,
Right.
and I know other people when I earlier in my career, I saw a lot of people who were early in their career as psychotherapists, and but they got dissatisfied with some of the other therapy approaches that were not as complex and didn't go as deep as the psychoanalytic approach did. And so here they became psychoanalysts, or at least psychoanalytically oriented therapists, mid-career, because they were hungering for something that had a more complete, broader theory and understanding of what it is to be human.
Deeply satisfying. And I still, reading through all different school of thoughts in psychoanalysis and learning about different types of interpretations, and each one of those interpretation work at what level of of psyche, as stimulating as they are, for me, that's not psychoanalysis for me. Interpretation is important, but not merely for the fact that it makes the person understand something more about their unconscious, but because it makes possible a deeper connection between the two parties sitting in the room, and the patient with parts of himself that was somehow disowned. So it's all about connection and facilitating the connection so the person can become more whole